Abraham Lincoln once said, "Next to creating a life, the finest thing a man can do is save one." Hi, this is Dr. Vivekanandan Lakshmipati from the Department of Biotechnology, JJ College of Arts and Science, Pudukkottai, and I am going to talk about the importance of first aid during laboratory accidents. Safety is an important aspect of any laboratory. Every laboratory must have a formal safety program to ensure a safe and healthy working environment. Safety should be the code of practice and it involves discipline in addressing the safe handling and containment of various hazardous material in a laboratory. It is a joint responsibility of both management and laboratory workers, and the duty of the management is to establish and maintain adequate standards, policies, procedures, work practices, and maintenance of buildings and equipment. On the other hand, it is the responsibility of the laboratory workers to understand and adopt good laboratory practices to achieve a healthy working environment. A safe lab, in addition to protecting laboratory workers, also helps to protect the environment and public from exposure to hazardous materials. The first step towards safety regulations for clinical laboratories was initiated by OSHA, Occupational Safety and Health Administration, and CDC, Center for Disease Control and Prevention, in 1970 when they published numerous safety standards in a clinical setup. Later in 1988, OSHA expanded the hazard communication standard to apply to hospital workers, which are frequently referred to as the Lab Right to Know standard. They insisted that management should be committed to safety of its employees and they should increase health and safety awareness among employees through proper educational programs. Let us first know what a first aid is. The Encyclopedia Britannica states first aid as measures to be taken immediately after an accident, not with an idea to cure, but in order to prevent further harm being done. It uses the available human and material resources at the site of accident to provide initial care to the victim of injury or sudden illness until more advanced care is provided. So, why is first aid important? The first reason is to restore and maintain vital functions and to preserve life. The ABC of basic life support are always the first priority. A for airway must be open so that air containing oxygen enters the body. B for breathing must take place so that oxygen passes through the lungs into the bloodstream. C for circulation. The heart must circulate oxygen carrying blood. The second reason is to prevent further injury or deterioration or prevent the victim's condition from worsening. The final one is to reassure the victim and make him as comfortable as possible, thereby promoting his recovery. What are the roles that first aid plays on the recovery of the victim? A first aid acts as a connector in between the victim and the physician. Its main role is to aid the victim in giving him temporary relief from the injury and helping the physician in his treatment. It in no way works against the rules of the physician and his processes. Neither it takes the credit out of him. For a first aider or the one who is giving the first aid, he should have a clear action plan before he starts to give the first aid. This action plan is a vital aid to the first aider in assessing whether the victim has any life threatening conditions and if any, immediate first aid is necessary. They are DRABC. D. Check for danger. Check whether there is any danger, any kind of danger to you, to others, or to victim. R. Check response. Check if the victim is conscious or unconscious. A. Check airway. If the victim does not respond, the first aider has to put one finger on the victim's forehead, two fingers on his jaw, and tilt his head while lifting the chin in order to clear any kind of block in the airway. B. Check for breathing. The first aider should be able to check whether the victim's chest is rising and falling. He should be able to hear victim's breathing and feel the breath on his cheek. C. For circulation. The first aider should be able to feel the pulse of the victim or any sign of life. So, who is a good first aider? Anyone who has certain key qualities in him can be considered a good first aider. Like, he has to have a calm nature. He should be able to carry the situation without showing any kind of panic or fear. He should be a keen observer. He should be able to observe minute changes taking place in the victim at that moment. He should be able to make use of anything that is there at that moment. He should be able to make the best possible use of any kind of resources available there. He should not scare the victim by telling unwanted things that may increase his fear and shock. He should be able to pacify the victim and help him keep his spirits and morale. So, if any person has all these qualities, he can be called a good first aider. A good first aid kit should contain cotton wool, adhesive tape, crepe bandage, sterile dressing, bandage, thermometer, scissors, glove, soap, pain reliever, antacid, ORS, ammonia, 5% solution of sodium carbonate, 2% solution of sodium carbonate, acetic acid, boric acid, and finally soap powder solution. Some of the common accidents that a laboratory worker can witness are mishaps due to acid or alkali splash on the skin, toxic substances or gases being inhaled, heat caused by open flames, hot liquids, inflammable liquids, explosions, broken glass, contamination by infected material, electric shock, etc. Nitric, sulfuric, hydrochloric, and trichloroacetic acid splashes are the most common mishaps occurring in laboratories. In all the cases, we have to wash the affected area immediately with large quantities of water. If acid has been splashed on the skin, we have to wash the skin thoroughly and repeatedly with water. After that, the affected skin has to be wiped with cotton wool soaked with 5% aqueous sodium carbonate. In the case of acid splashes in the eyes, we have to wash the eyes immediately with large quantity of water sprayed from a wash bottle or rubber bulb. Water should be sprayed into the corner of the eye near the nose. After washing, 4 drops of 2% aqueous sodium bicarbonate should be put into the eyes. In the case of alkali splash, sodium, potassium, and ammonium hydroxide are the most common ones. Here also, we have to wash the affected area immediately with large quantities of water. It should be noted that alkali burns are more serious than acid burns. If the alkali splashes on the skin, we have to wash thoroughly and repeatedly with water. The affected skin should be wiped with cotton soaked in 5% acetic acid. If the alkali splashes in the eyes should be washed immediately with large quantities of water sprayed from a wash bottle or rubber bulb. Water should be sprayed into the corner of the eye near the nose. After this, the eye should be washed with a saturated solution of boric acid by applying the drops repeatedly. In the case of alkalis being swallowed, the patient should be made to drink 5% solution of acetic acid or lemon juice or dilute vinegar. He should gargle with the same acid solution. He should be given 3 or 4 glasses of ordinary water. If the lips and tongue are burned by the alkali, the affected area should be rinsed thoroughly with water and with 5% acetic acid. In the case of poisoning, a physician or a qualified nurse should be sent immediately, specifying the toxic substance involved. The victim should be kept in the open air while waiting for the physician. Burns caused by heat fall into 2 categories: severe burns and minor burns. Severe burns are those burns when burning ether or boiling water is spilled over the victim. If the victim is on fire, he should be rolled in a blanket or overall to smoothen the flames. The victim should be laid on the ground. Any attempt to remove his clothing should not be done. He should be covered if he is cold. Any kind of treatment should not be applied to the burn. This must be left to the physician. Minor burns are those burns which affects a small area of skin caused by hot glassware or a Bunsen flame. In this case, the affected part should be plunged into the cold water or ice to soothe the pain. Mercurochrome or acryflavin ointment should be applied to the burn. Dry gauze dressing should be done loosely. If the burn becomes infected or does not heal, the patient should be referred to a physician. During injuries caused by broken glass, the wound should be washed immediately to remove any glass pieces. Mercurochrome or acryflavin ointment should be applied to the wound. It should be covered with gauze and adhesive tape. Some wounds are caused by broken glassware containing stool, pus, etc. In that case, the wound should be washed immediately with water. If the cut is not bleeding, it should be squeezed hard to make it bleed for several minutes. The whole area, that is the edges of the cut and inside the cut, should be wiped with an antiseptic lotion. It should be washed thoroughly with soapy water and wiped again with antiseptic lotion. The patient should be referred to a physician if the material involved is known to be very infective. During a body shock due to electrical appliances, it may cause fainting and asphyxia. Before doing anything else, the main switch should be put off. The CPR should be started if no breathing or no pulse is felt. The patient should be shifted to emergency immediately. In some cases, the victim can faint or lose his consciousness. Fainting is a brief loss of consciousness and is a result of an interference with the function of the brain. There are many causes of unconsciousness, the most common of which are fainting, head injury, epilepsy, stroke, poisoning, diabetes, and conditions associated with lack of oxygen. If a person faints, then he should be caught before he falls. The person should be pinched and seen if he moves or opens his eyes. Any kind of injury should be examined. The head should be tilted back and arms kept at right angle to the body. The legs should be raised to 8 to 12 inches. This promotes blood flow to the brain. Any tight clothing should be loosened. The victim should be kept warm if it is cold outside. In some cases, where the lab is present in the cold regions, persons can be affected from frostbite. Frostbite occurs when the body tissues freeze after exposure to below zero temperatures. The signs and symptoms include white, waxy looking skin that is firm to the touch, but the tissue underneath feels soft and pain, followed by numbness. In such cases, the frostbitten toes, ears should be covered with warm hands. The affected area can be warmed by breathing on them or placing them in a warm area of the body or by dipping the affected area in warm water. The tiny ice crystals in the tissue should not be rubbed as it may cause more damage. The snow on the area should not be rubbed as this may cause further freezing, and direct heat should not be applied as this may rewarm the area too quickly. The patient should not be allowed to walk. Blisters should not be broken if any. A heat stroke strikes suddenly with very little warning. When the body's cooling system fails, the body temperature rises fast. This creates an emergency condition. The signs are the temperature of the body is very high, hot and dry. The skin is red with no sweating and fast pulse rate, dilated pupils, confusion, and sometimes there might be loss of consciousness. During such case, the body temperature should be lowered by removing or loosening the clothing or fanning the person. Ice pack or cold compressors should be kept to the neck, under the armpits, and to the groin area. The patient should drink lots of fluid, and especially those who perspire more should drink as much fluid as possible. The patient should stay away from places that are hot. Finally, I'll leave you with a small message. Whether it's a minor situation or something more serious, first aid knowledge will give you the confidence to act. You could be the difference between life and death. Thank you. Jai Hind.